Hi, my name is Jessica Dykes. The title of my speech is Emphysema. Do you know anyone that has been diagnosed with emphysema? Maybe a parent or grandparent that you have has possibly dealt with this condition? I chose this topic because my grandfather was diagnosed with emphysema. I will discuss the three main causes of emphysema, which are tobacco smoke, air pollution, and manufacturing fumes. Emphysema is a lung disease characterized by increased shortness of breath during periods of exertion, as well as breathing troubles even when sitting. This condition is more common in older people in general, but can be caused by or aggravated by cigarette smoking. Emphysema can also be caused by protein deficiency. Hi, my name is Jessica Dykes, and the title of my speech is on emphysema. Do you know any? Hi, my name is Jessica Dykes, and my speech is on emphysema. Do you know anyone that has been diagnosed with emphysema? Maybe a parent or grandparent that you have has possibly dealt with this condition? I chose this topic because my grandfather was diagnosed with emphysema. I will discuss the three main causes of emphysema, which are tobacco smoke, air pollution, and manufacturing fumes. Emphysema is a lung disease characterized by increased shortness of breath during periods of exertion, as well as breathing troubles even when sitting. This condition is more common in older people in general, but can be caused by or aggravated by cigarette smoking. Emphysema can also be caused by a protein deficiency that can be inherited. Emphysema is one of the two major clinical conditions experienced by people with chronic obstructive pulmonary disease, also known as COPD, and chronic airflow obstruction. Emphysema affects the lung tissues by damaging the tissues and destroying the structures of the lungs that make breathing possible. This condition turns the spherical-shaped air sacs in your lungs into large, irregular pockets with holes in the walls of the tissues in the air sacs. This reduces the surface area inside the lungs and in turn reduces the amount of oxygen that can enter your bloodstream. Emphysema also slowly destroys the elastic fibers that hold open the small airways leading to the air sacs in your lungs. With the increases in life expectancy in the United States, the number of individuals significantly affected by emphysema is expected to increase with time. This is due to the fact that the elderly are prone to developing this condition in their later years. The incidence of emphysema increases with age and is much more common in men than in women. Next, I will discuss some of the most common causes of emphysema. A person can contract emphysema simply due to old age, but there are other environmental exposures that can greatly increase a person's risk. Cigarette smoking is one of the leading causes of emphysema. Smoking on a regular basis greatly increases a person's chance of contracting emphysema later in life, and also worsens the symptoms of anyone who already has this condition and continues to smoke. Cigarette smoking can be blamed for a decrease in pulmonary function for all smokers, but 10 to 15% of smokers show no ill effects at all. Marijuana smoke, air pollution, coal dust, and manufacturing fumes can also cause emphysema. While the condition is virtually the same with all types of exposure, it can affect your lungs to varying degrees depending on the exposure time and severity. Emphysema can adversely affect not only your ability to perform physically demanding activities, but it also may limit some of your normal daily activities. Symptoms of emphysema can affect you and your family's plans and routines in ways you can't always anticipate. This condition can cause changes in your mood and relations with others. But if you can talk to your family members, you'll be better able to meet the challenges of living with this disease. Emphysema was first officially recognized as a medical condition in the late 1600s. The condition was first recognized among working men of this time and was simply diagnosed as a lung problem that affected the amount of hard work a person could perform. During this time, the actual condition was given a name due to the similarities of the damage of various individuals who had this disease. Simple medical tools were used to diagnose emphysema in the early days of its recognition. This mostly consisted of a doctor listening for specific breathing sounds using a stethoscope. Medical procedures have advanced greatly since then, thankfully. Today, in addition to using breathing sounds as a means of diagnosis, both X-rays and lung function tests can be used to diagnose emphysema. Your doctor may also do blood work or CT scans to check for signs of emphysema. I hope my speech on emphysema has given you more insight into this condition. Along with information on the major causes of emphysema, I included details on the physical damage to the body and how it affects your daily life. Hopefully this will lead to a greater understanding of this condition and its symptoms.